Ambulatory care. What is ambulatory care? Ambulatory care is a type of medical care that is provided to patients who do not need to be admitted to a hospital for treatment. These type of procedures and treatments are sometimes referred to as outpatient care. Healthcare access in rural communities. Access to healthcare services is critical to good health. Yet, rural residents face a variety of access barriers. Ideally, residents should be able to conveniently and confidently access services such as primary care, dental care, behavioral care, emergency care, and public health services. According to Healthy People 2020, access to health care is important for overall physical, social, mental health status, disease prevention, quality of life, life expectancy, etc. Moving on. Rural versus urban ambulatory care. First, cancer care. Comparisons of rural and urban health care for cancer have focused on variation in staging, mortality, and quality of care. There were 12 studies comparing urban and rural cancer care. 3 studies examined mortality, 9 studies examined cancer stages at the time of diagnosis, 3 studies examined the relationship between screening and disease progression, and 5 looked at treatment quality. Moving on. Diabetes, end-stage renal disease. Only 3 studies examined potential differences in health outcomes between urban and rural residents of diabetes or kidney disease. One moderate to high quality study relied on patient self-report to assess complications of diabetes in a national sample, while a low quality examined the incidence of diabetes-related end-stage renal disease. The third study of high quality examined mortality rates between urban and rural patients receiving dialysis. What are barriers to healthcare access in rural areas? First, distance and transportation. Rural populations are more likely to have to travel long distances to access healthcare services. In addition, the lack of reliable transportation is a barrier to care. In urban areas, public transit is general an option for patients to get to medical appointments. However, these transportation services are often lagging in rural areas. Second, workforce shortages. Healthcare workforce shortages impact healthcare access in rural communities. One measure of healthcare access is having a regular source of care, which is dependent on having an adequate healthcare workforce. Sometimes healthcare services researchers argue that evaluating healthcare access by simply measuring provides availability is not an adequate measure to fully understand healthcare access. Moving Now let's see what the typical problems are in our current healthcare system. First, paid distribution of healthcare facilities. While India is one of the most preferred destinations for medical tourism, which implies that some of our hospitals can provide world-class treatment at relatively lower cost, we also have hospitals which are undersatisfied, have insufficient facilities, no medicines, and no treatments for poor people or even for people who are rich. Second, lack of manpower. We find a shortage of trained and skilled doctors, nurses, technicians, and other medical staff. In 2005, there were a shortage of 2 million doctors and 4 million nurses in India. It is huge. How can we promote healthcare facilities? We can do it by creating suitable physical environment, by training and motivating health workers, by concentrating on the patient, decentralizing the public health services, and also developing infrastructure, improving the doctor population ratio, and increasing the number of medical colleges. Thank you.